I want you to imagine something for me today. It's a Saturday night, you're at the mall with your friends having a great time. While you're walking around, you spot this old couple really cute together. But suddenly, one of them collapses. You run to them, you're screaming for help, you're looking around for help, but you're not able to find any medical help. What would you do? Would you know how to save a life in such a situation? I know some of you are thinking, I know how to give compressions. I've seen movies where they give CPR, or maybe even gotten a certificate course on how to give compressions. But let me tell you, that's not always enough. Let me explain why. When a person collapses and you're not able to feel a pulse, it's usually a cardiac arrest. A cardiac arrest, put simply, is the heart not being able to effectively pump blood out to the organs. How does the heart normally function? It creates an electrical impulse in a regular rhythm, and this helps the heart to pump blood out to the organs day in and day out. In certain types of cardiac arrest, although there is an electrical impulse, the rhythm that it generates is very irregular. This abnormal rhythm is why the heart is not able to normally function and pump blood out. So what is it that stops this abnormal rhythm and restarts the heart? Shock. You have to deliver shock for this abnormal rhythm to be abolished and for the heart to be able to function normally once again. Think of this like your frozen laptop screen. What do you do when your screen is frozen? If you're anybody like me, I frantically type all the keys in front of me. I try to hit it on its head. But what finally works is when I reboot the system. So a shock is doing exactly that. It's rebooting. Not all types of cardiac arrest needs a shock. But this is where AED comes into play and why just CPR might not be enough. When AEDs are present, they analyze automatically and let us know when a shock needs to be delivered. Hello everybody, I'm Dr. Varshini Srinivasan, and we're a group of doctors and we're here to raise some awareness about pressing medical matters. In today's video, we're going to see all about this wonder device called Automated External Defibrillator. Did you know that using an AED within the first few moments of collapse in a cardiac arrest helps improve the rates of survival by up to 70%? Isn't that pretty huge? But you know what's more impressive? Anybody, and I mean anybody, even people without proper medical training, can use this device. That's how easy the AED's prompts are to follow. Now that we've spoken so much about this device, aren't you curious to know how it looks? Dr. Prajith will now show us how an AED looks and the few basic steps on how to use them.
Hey guys, I'm Dr. Prajith here, and today we're going to talk about AED. So this is an AED. So there will be signs where AED kits will be available. In case of emergency, you're supposed to look at those signs and get the AED to the patient. So first, let's talk about some parts that are present in the AED. If you open this case up, you can see a power button here, a shock button, and pads that will be provided. So there are different kinds of pads. There is an adult pad and a pediatric pad. So you can use the adult pad for the pediatric patients, but you can't use the pediatric pad for the adult patients. So let's go over scenarios, especially what happens when your family member or when someone just collapses. So there are certain procedures or protocols that we have to follow. The first thing that you have to do is call for help. Call for help because someone has to dial the emergency services like 108, and then someone has to get the AED, and the other person has to go and start giving CPR. So before giving CPR, there are a few steps that one should proceed with, and this will be discussed in a detailed video afterwards. But you're supposed to check for scene safety first, and then you're supposed to check for pulse, respiration, and then start giving CPR immediately. All of this should happen within 10 seconds. So you're giving CPR and your friend or someone else is going to bring the AED, right? So So what is the first thing that you do? You're supposed to continue giving CPR, and the other person is supposed to switch on the AED, right? Switch on the AED, and the next step is to connect the pads, right? Over here, it's already connected because this is a training module, but in actual AEDs, this connection won't be there, and you have to take the pads and connect it. So there are many special situations pertaining to this, and I'm sure Dr. Varshini will talk about that. And there is specific pad placement for for the AED. So there are only two main pads. So if you see over here, there'll be image description of where the pad should actually be placed. The first pad should be placed below the right collar, below the right collarbone, and the second pad should be placed near the left nipple, below the left nipple, right? And some AEDs will have this cross section. So the horizontal cross section should be at the level of nipple, whereas the vertical cross section should be at the level of sternum. So before you place the pad, it's important to open the clothing and all these other stuff that are present on the patient. Open it up and then place the pads. Okay. So now you have switched the AED on. You have placed the pads. Right, what is the next step to do? The AED will power on and it will start analyzing the rhythm. So there are certain things that are really important at this time. The first thing is, when the AED is analyzing the rhythm, you have to stand clear and not give CPR. So let the AED do its job. The AED will give you voice prompts to talk about as to what is happening. So the AED will say, analyzing now, stand clear. So at that moment, you're supposed to stand clear, let the AED analyze the rhythm, and it will give you further voice prompts on what to do. So the first scenario that can happen is if it's a shockable rhythm, right? If it's a shockable rhythm, the AED is going to say that shock, shock, shock. So at that time, the person who's operating the AED should say clear, and everyone should step away from the patient, including the person who's giving the CPR, and even step away from anything metallic like the bed rail and all if it's in the hospital setting. And once everyone is cleared, you should press the shock button, right? So after the AED delivers the shock, you should immediately start giving CPR, right? So remember to stand clear and start giving CPR after the shock is done. So the other scenario is when an AED says that the rhythm is non-shockable. So the AED will say analyzing rhythm now, rhythm not shockable. At that time, you have to start giving CPR immediately, right? But remember to stand clear when the AED is analyzing the rhythm.
Now that we've seen how an AED works, let's go over some special circumstances that might cause doubt when we try to use them. First, what if the person you're trying to use an AED on is very hairy? You can do two things in this scenario. One, you might find a razor in the AED kit that you can use to quickly shave off the area where you need to place the pads. But what if a razor is not available? The next best thing you can do is, if you have two sets of pads, you can use one set of pads as a waxing device, wax off the hair, and then place the next set of pads where it needs to be placed. Second, what if the person you're trying to revive is somehow wet or is in a pool of water? We all know water conducts electricity, so we cannot place the pads directly on wet surface. We have to drag the patient to a drier area, wipe off the liquid, and place the AED pads only on a dry skin. Then, what if the person who's collapsed is a pregnant lady? Can you use an AED on them? Yes, definitely you can. It does not cause harm to the baby. And what if this person who's collapsed has a medication patch or an implanted pacemaker already? You can use AEDs on them, but make sure you do not place the AEDs directly on these devices or medication patches. Feel for any bulges in the upper chest area and avoid these bulges, and place the pads adjacent to these bulges if it is present. I hope that clears some questions in your head about how to use them. In an ideal world, AEDs should be present everywhere, as one can collapse at any given point of time or place. But realistically, let's at least try to make sure that these devices are present in the apartment communities that we live in the schools that we send our children to, in gyms and dance classes that we frequent, offices that we go to every day, malls, airports, and even railway stations. In contrast to the West, many Indian heart journals state that the use, availability, and adoption of AEDs is much lower in India than to the West. First of all, we do not have enough devices, and second, even when there is a device present, we lack the awareness and the training on how to use them. We must change this. I think that it's really unfair that the chances of somebody surviving a cardiac arrest in India is much lower than in the West. Let's together raise awareness and create an India where we do not have to lose even one more life to a cardiac arrest. We should not have to lose a life because of the lack of resources or the awareness on how to use them. Knowing how to use the right thing at the right time could help you save a life someday. Thank you for your time.